Good morning. Thank you so much for staying with us and joining us this morning on the program Radio Doctor. My name is Rose Yusuf Kaiser, and this is Women Radio WFM 91.7, Nigeria's first radio station for women and their families. How is your day going? I hope you're feeling healthy today. I hope your kids are doing well today. All right. So, this is Radio Doctor, your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on radio, right here on Women Radio 91.7. Now, Radio Doctor comes to you from 10 a.m. Mondays through Fridays. All right, so today on Radio Doctor, our doctor in the house is Olufumilola Akinola. She's a consultant pediatrician at St. Ives Family Hospital. Good morning, Dr. Akinola. How are you and how's the weekend?
Good morning. I'm happy to join you this morning. My weekend was beautiful. Thank you.
All right. Thank you, too. Great to have you join us this morning. All right. So today, Dr. Akinola will be consulting and advising on managing HIV in children. All right, so that's our topic for today, and that's what Dr. Akinola will be consulting and advising on, managing HIV on children. Now, you know that Mondays is always for children's health, and that's why we have a consultant pediatrician with us on Mondays, and then on Tuesdays we get to look at women's health. All right, different aspects of women's health is what we discuss on Tuesdays, and on Wednesdays we get to look at general health. On Thursdays also we look at health for elderly, and then on Fridays we get to look at general health also. So today is for children's health, hence we're looking at managing HIV in children. Now, 1st of December was World AIDS Day. All right, so there was a lot of talk, a lot of awareness on AIDS, HIV and AIDS in adults, in children and all. So yeah, today being Monday, we are looking at HIV in children. All right, the phone lines are open. 07000 917 917 are the numbers to call. 07000 917 917. Send us a text or a WhatsApp message. 070 317 56537. 070 317 56537 is a number to send in a text message or a WhatsApp message. You can go log on to our website www.wfm917.com and of course get to listen to us from any part of the world. Better still, you can download our mobile app WFM917. Follow us on our social media platforms, Facebook, Instagram, X, and of course YouTube at WFM917, and of course get to be part of the conversation today. All right, so today, like I said, on Radio Doctor is managing HIV in children, and we have Dr. Olufumilola Akinola today, consulting and advising on managing HIV in children. So let's get on straight to it. This is Women Radio WFM 91.7, and this is 9 minutes, or better still, 10 minutes after 10 right here. So let's get on straight to it, Dr. Akinola. Now, at what age can HIV be diagnosed in infants, and what are the diagnostic methods used?
Thank you very much. HIV can be diagnosed definitively by virology testing in most non-breastfed infants with perinatal exposed, which are HIV perinatal exposed from age of 6 weeks. This testing is through a nucleic acid PCR assay, and which is this standard detection method used in infants and young children, which is HIV DNA PCR or RNA PCR. So it can be diagnosed as early as 6 weeks, and the method of testing is through the nucleic acid PCR assay, or which can be either DNA PCR or RNA PCR. So the standard method is that it is advised that all HIV exposed infants should undergo the virology testing at the age of 14 to 21 days. Then, if results are negative, this test should be repeated at age 1 to 2 months and age 4 to 6 months to identify or exclude HIV infection as early as possible. So for HIV exposed children, this is the guideline. But if I'm answering your question, it can be detected as early as 6 weeks of age in most children. But the guideline is where it is possible, they do the first testing at age 14 to 21 days. If results are negative, they can also be repeated between 1 month and 2 months of age, then 4 to 6 months of age to identify and exclude HIV infection as early as possible.
Okay. Thank you so much, Dr. Akinola, for that. This is Women Radio WFM 91.7, 30 minutes after 10 right here. And this is the program Radio Doctor. All right, we have doctors consulting and advising for free on Women Radio WFM 91.7. All right, Dr. Akinola has just told us how this can be diagnosed in infants. All right, she says as early as 6 weeks. All right, and how this can be done. Now, Dr. Akinola, let's hear the common modes of HIV transmission in children and how can these transmissions be prevented. Now, we know that there's mother to child transmission and, some other forms too. So please let us know the modes of HIV transmission in children and how these transmissions can be prevented in the first place. Hello, Dr. Akinola, are you with us?
Yes.
Okay.
The common mode of transmission of HIV is children, just as you mentioned, it's due to the mother to child transmission. And this is also described as the perinatal transmission. That is, when HIV is passed from a mother with HIV to their children during pregnancy, childbirth, or labor and delivery, or during breastfeeding through breast milk. Perinatal transmission of HIV, the mother to child transmission, as you mentioned earlier. And this is the common mode of transmission of HIV to children, which takes about 80% or more of methods of transmitting HIV to children. But other ways that HIV can be transmitted to children involves through transfusion of blood and blood products, through sharing of needles or instruments contaminated with infected body fluids or blood. Through this, HIV can also be transmitted to children when they use contaminated blood or blood products or use of contaminated needles, sharing of needles or sharp instruments which are contaminated or infected with body fluids or blood. Sexual contact with infected person by an adolescent or teenage children is also another way in which children, especially the adolescents and the teenagers that are sexually active, can get infected with HIV virus.
Okay. All right. Thank you so much, Dr. Kinola, for letting us know the modes of HIV transmission in children and how these transmissions, come about. All right. So, thank you so much, Dr. Kinola. Now, for all of these transmissions, is there a way that the mother, the child can, or rather, is there a way to stop the mother to child transmissions? Because for the other ones that you mentioned, it could be easily prevented using needles and all of that. So it's just to probably sterilize them or don't use new needles for children, all of that. So, but for mother to child transmission, especially from the womb, is there a way to stop that kind of transmission?
Yes, there is way we can stop or reduce or totally eradicate transmission of mother to child of HIV infection with the use of, and this is through the prevention of mother-to-child transmission using antiretroviral therapy. It is recommended that all HIV positive patients, either those that have been positive before or those that have been that are detected during pregnancy, should be antiretroviral therapy to reduce the viral loads of HIV. So mothers that are HIV positive should ensure that they register in a facility. Most government facility, have a plan and they have guidelines or they have treatment plan for most HIV positive mothers. And these sort of mothers are placed on antiretroviral therapies, as part of prevention of mother-to-child transmission of HIV to reduce the viral loads. So all these ones, they are monitored during the pregnancy to ensure that the viral loads, the HIV virus load is reduced, as much as possible, even to the level at which it is undetectable for the time of delivery. So at delivery, it is recommended that baby born to HIV infected mothers, they receive antiretroviral drugs, such as nevirapine or zidovudine, depending on what is available, of the center or probably which the facilities are using after birth. And they should also receive medication to prevent HIV associated infection. Just as I mentioned earlier, HIV positive mother should also ensure they take their HIV medication to maintain this. Some of them will have been reduced viral loads before birth. And this should also be maintained, to this undetected level. I mean, the viral loads during pregnancy, labor, and delivery, and also while breastfeeding, to reduce the chance of transmitting this to their babies. Other ways, maybe for older children, by hand washing, which is very important, to reduce the germs load that you carry, and also there should be safe contamination of instruments, before you use, especially needles or sharp instruments, can be in contact with your body fluids or your blood, it should be decontaminated, before you use.
Okay. All right. Thank you so much, Dr. Akinola, for giving us, how there's all the modes of transmission the children can be prevented. Okay, 22 minutes after 10 right here on Women Radio WFM 91.7. Feel free to dial the number 07000 917 917. Send us a text or a WhatsApp message 070 565 Let's get to hear from you, your thoughts, your questions, and your concerns when it comes to HIV in children. All right, Dr. Akinola, now let's look at what are some of the main challenges in managing HIV in pediatric patients compared to adults. So, because these are little ones, these are young ones. In fact, some of them as early as maybe their first few weeks of coming to this earth. So, what are some of the challenges in managing HIV in children compared to adults?
Thank you very much. The barriers to efficient management of pediatric HIV rates compared to adults is delayed infant diagnosis. That's one of the common barriers. Many of these children HIV positive, they eventually comes to be HIV positives. They are mostly, just as I mentioned earlier, got this virus from their mother through mother-to-child transmission, and their program put in place by the government, to prevent this mother-to-child transmission of HIV, just as I've mentioned earlier. First, it starts from making diagnosis of the HIV virus in the mother during either when they register at the point of registration for antenatal care, or during the time that they are attending antenatal care in various hospitals before delivery. So most of these mothers that are HIV positive, they will be tested for their viral loads and put on medication to reduce this viral load, even to the level at which the virus are not detected in their blood, even before the birth of their child. So, and also during delivery, they are monitored, and also after delivery, preferably before 6 hours of delivery, these babies that are born to HIV positive mothers, they are described as perinatally exposed to HIV babies. They are exposed because their mother is positive. They are not necessarily positive, but because their mother is positive, chance of transmitting this HIV virus to the babies either during the time of pregnancy, either during the time of labor, or during childbirth. By the time the baby comes out, there is also increased risk of transmitting the virus, through blood from the mother to child. And even after delivery, HIV virus can also be transmitted, through the breast milk. About 1%, 1 to 2% risk of transmitting HIV virus through breast milk. So if they are also breastfeeding, baby can also, there's risk of transmitting this this virus. But in a facility or where a woman register, in a facility that they have program, especially in our government hospital, where we have programs, our plan for these HIV positive mothers, they put all things in place, to prevent or reduce this risk, by starting the mother on antiretroviral therapy. And also, as soon as baby is born, preferably within the 6 hours of birth, to put this child also on antiretroviral therapy, for the first 6 months, first 6 weeks of life, before you start doing testing to detect maybe this child is positive already or the child is not yet positive.
Okay.
But a child of mothers that probably they don't register in some of these are government or a private, even in private hospital, most of the private hospital, they have an open access even to link their patients that are HIV positive, to link and refer them to where they can get access to some of these, to this treatment. So where a mother does not have access either to a good private hospital or a government facility, probably didn't even go for antenatal care at home in probably some of our villages, or remote area, there is risk. It's even diagnosing these HIV exposed infants, and they don't have this benefit of taking this antiretroviral therapy or monitoring them. And you see that they are exposed to this virus at a longer time, and probably it's when some of them are infected and they are fully come down with HIV virus that they present in the hospital, and probably this, if you are not careful, this is too late in that, and if they even fall into the hands of a practitioner or probably an unskilled or health practitioner that even don't know what to do, we just treat them even without even making diagnosis. So the delayed infant HIV diagnosis is one of the barriers to efficient management of pediatrics HIV in our environment. Then, secondly, we also have lack of appropriate pediatric antiretroviral formulation. Most of the primary antiretroviral formulation is planned for adults. You see them, the treatment, the therapy they have to take, they are prepared in form of tablets, for adults to easily swallow. But you realize that splitting of adult dose solid form tablets formulation of ARV therapy is suboptimal for children. And in most of our center, it may be the only available option
for children.
That is available for children. For children, their drugs, you don't give the same dose of drug for all children. For children, the dose of you give children are based on their weight and maybe possibly age. For what you give to age 1 year is different from some we give to age 5, 8, and 12 years old. Depending, you have to calculate this dose based on their age. So that means for adults, you have to start. If you now have tablets, you have to start dividing approximately dividing the tablet in a way that will be suitable for the weight of the children, and which may be at the end may be suboptimal, for use in these children. And also the preparation may not be suitable, tablets. Then you also look at most children cannot swallow tablets. So most of them will do well if you have syrup, and probably in liquid form, where it will be easily for them to swallow. So that means for most of this preparation, they don't think about children when they are preparing it. So some of these tablets, you have to take it back to the pharmacy where they have to prepare it, dissolve it, and for the children. Other things, also the taste. Most children preparation is better to prepare it in a way which the taste is as acceptable. When it's too bitter, they may not want to, to take even the liquid preparation, and this affect the adherence, to medication. And also lack of appropriate, lack of skilled health personnel. Most health personnel, they are not well trained, to handle pediatric HIV treatment, So most people, your health personnel that take care of children, HIV patients, need to be trained, well trained how to handle this, kind of patient. But most people, they are not skilled enough to be able to handle children or babies with HIV/AIDS. So these are the common problems. That also, when it comes to children treatment, they have to go through, their provider, maybe their mother or probably any caregiver, and treatment adherence and every other thing. Also have to how knowledgeable, how acceptable this care provider, or is ready to work with the doctor or healthcare provider in handling this sort of
Okay. Right. Thank you so much, Dr. Akinola. This is Women Radio WFM 91.7. Thank you so much for staying with us right here on the program Radio Doctor. My name is Rose Yusuf Kaiser, and today we have Dr. Olufumilola Akinola, a pediatrician, a consultant pediatrician at St. Ives Family Hospital. And today she's consulting and advising on managing HIV in children. So let's get your thoughts, let's get your concerns on managing HIV in children right here on Women Radio WFM 91.7. The number to call is 07000 917 917. Send a text or a WhatsApp message to 070 317 56537. What's your thoughts? Let's get what your content on managing HIV in children. Dr. Akinola is here consulting and advising on managing HIV in children. All right, 24 minutes to 11 right here on Women Radio, and this is still Radio Doctor. All right, so Dr. Akinola has told us quite a lot about, the major challenges in managing HIV in pediatric patients, that's children, compared to that of adults. All right, so let's look at the treatment options. Now, you mentioned antiretroviral therapy, that's ART options, all right, available for children. But apart from this, the ART options, that's the ART options, are there any other options, available for children with HIV in terms of medications? And how important is it to adhere to medications in children with HIV? And, what kind of strategies can aid in ensuring adherence? So first of all, we're asking, it's antiretroviral therapy the only option for children, available for children with HIV? And how is it important to adhere to medications when it comes to HIV in children?
As at now, the only important option for HIV positive patients is the use of antiretroviral therapy. And it is advised that as soon as these children are diagnosed as positive to HIV patients, they should start their therapy. As soon as they are diagnosed as positive, or especially all HIV positive patients under 24 months old should start antiretroviral therapy as soon as possible. So, and there are various options for antiretroviral therapy that are available depending on the weight, the age, depending on the weight and the age of the patient. What is important, I would say, is that as soon as possible, when you have suspicions and this of that for symptom that this child may be HIV positive, it's important you present, take this child to your nearest health facility, or especially government facility, where they can enroll these patients into the HIV and the other mother to child prevention program. Most of the drugs as at now is still free. So if you are buying outside, it may be too expensive. So take these children to the nearest government hospital. They know what to do, and as soon as they know that they are positive, they know what to do. They may need to refer you to a center where this child may be properly taken care of. It doesn't mean that when they need to refer, doesn't mean that it is severe or probably that child is going to die. What it means is that this child needs to be referred to where he can easily get access to medication and the treatment that the child needs, to survive. And even if this starts from mothers that are HIV positive, I will continue to lay emphasis on it. A mother that is HIV positive if you start treatment during pregnancy, as soon as pregnant, and you have access to this treatment, the preventing transmission of HIV or preventing your child, the higher the chance of preventing your unborn child from having HIV, because they will place you on treatment to prevent you transmitting this virus to your child. And this process starts when you are pregnant.
Okay.
For this child.
All right.
We've seen a case of mothers being positive for HIV, and when she delivers all her children, none of them is HIV positive. If you are enrolled in this program and you follow your medication, use of your medication, your treatment, you follow it and you adhere to it vigorously,
okay,
there is higher chance that your unborn children will not be HIV positive. But if you miss this chance, it now depends on how soon this baby that you born is detected as having from either being HIV positive or negative. So I would advise start the treatment as early as possible. Then when it now comes to adherence, then I would say adherence, failure to adhere is a serious problem in HIV treatment. When you fail, either in children or in adults, if you have been diagnosed as HIV positive, failure to adherence is a serious problem in HIV treatment, because it not only affects the patient but also affects the healthcare system. Skipping HIV medicine allows HIV to multiply, and this increases the risk of drug resistance and HIV. Then poor adherence to HIV treatment regimen also allow HIV to destroy the immune system. A damaged immune system makes it hard for the body to fight off infection, and they also risk exposure to certain cancer. So it is important for us to for HIV positive patients on treatment to adhere to their treatment medication. Medication non-adherence in patients, it leads to substantial worsening of the disease. It leads to death, and it can also increase the health care cost, to the government.
Okay. All right, thank you so much, Dr. Akinola. 07000 917 is the number to call. Let's get to hear from you this morning. Send me a text or a WhatsApp message to 070 317 56537. This is Radio Doctor right here on Women Radio WFM 91.7. And of course, the doctor is here consulting and advising on HIV in children. What are your concerns? What are your questions? Send them in on 070 317 56537. This is 15 minutes to 11 right here. And Dr. Akinola has been talking to us about HIV in children. All right. Now, Dr. Akinola, let's talk about breastfeeding. Now, can a HIV positive mother breastfeed her baby? What kind of precautions should be taken if this can actually happen?
Thank you very much. exclusive breastfeeding is recommended in the first 6 months of life for all children to provide nutritional support that will help in their growth and development. We in HIV positive mothers, we also encourage exclusive breastfeeding. It's still strongly advised, to reduce illness, to improve growth and development in their children. We are in this part of the world, we are developing a country.
Yeah.
We have a lot of people still living under poverty. So exclusive breastfeeding provide an easy access for mothers, to feed their baby, especially those, in poor rural area. Sometimes it may be difficult even to feed. So WHO also released guidelines to advise that a country that have options to promote, that have chosen the option to promote exclusive breastfeeding, that with ART. So mothers living with HIV that are on ART, they on antiretroviral therapy and are well adhered to their therapy, can breastfeed their baby exclusively for the first 6 months. So there is nothing wrong if that is the option.
Okay.
Choose. It is you can as a woman living with HIV, you can exclusively breastfeed your baby for the first 6 months, just like other mothers, provided that you are on your treatment for your antiretroviral therapy, and you have adherence to your medication. That means you are using your medication regularly to reduce your viral loads. When your viral load is reduced, then it reduces the risk of transmitting this virus to your patient and to your babies. So there's nothing wrong with exclusive breastfeeding in an HIV positive mother, if that is the option that you choose.
Yeah.
But if you are well-to-do, you can provide the other option, formula feeding, and you can supply what your baby needs for the first 6 months of life. You can provide for that. Then you can choose the option of using formula to feed this baby. What is not really advised is misfeeding. Using breastfeeding and formula, or using breastfeeding another option, to feed this kind of perinatally exposed patient, because it increases the risk of transmission, especially for those that have babies that have sore in their mouths when they are breastfeeding, and probably mother have cracked nipples at the baby is now sucking, there is increased risk of taking the body fluid from the mother, or babies that have sore, that absorbing this milk that is infected from. So make the option, and this is best discussed as early as possible, before birth of the child. If the option you have decided is you want to breastfeed or you want to do other option, but whatever one, that should be discussed with your gynecologist or with your pediatrician before your baby's birth, so that as soon as your baby is born, follow the option that you have chosen with your doctor, as soon as possible. Then at 6 months of age, then this can be stopped. Breastfeeding can be stopped, and you go for other, semi-solid food, which baby can take, and you introduce your baby from 6 months of age.
Okay.
Though different countries have different guidelines. For now, even as at now, WHO even said that baby can still even breastfeed, as long as the mother is on therapy and the viral load is undetectable for as long as mothers choose. But it's best, to stop at 6 months of age. 6 months,
okay.
Do solid food widely.
All right.
You also ensure that baby is tested.
Okay. All right. Thank you so much, Dr. Akinola. We've come to the end of the program, but in just a minute, let's have your final words on managing HIV in children. What's the take home? What would you want parents and guardians to take home today? Just in a minute.
Since we were able to identify that perinatal transmission, that is mother to child transmission, is the commonest mode of transmission of HIV to children, I would advise that as soon as you are pregnant, please register in a good hospital and ensure that you know your HIV status, so that your child, can be managed effectively to prevent transmission of HIV. The higher you register if you are positive, the higher the chance of preventing your child from having HIV positive, becoming HIV positive. And even if you're positive, use your HIV medication, and regularly to prevent transmission to your baby. And even if your baby have to be on antiretroviral therapy, ensure adherence to this medication.
Okay. All right.
Prevent having full-blown HIV.
Okay. Thank you so much, Dr. Akinola, for being a part of our program today.
Thank you for having me.
All right. Do have a great day and enjoy the rest of the week.
Thanks.
All right, so that's the much you can take this morning on Radio Doctor. Very big thank you to Dr. Akinola for today's free consultation and advice on managing HIV in children. Dr. Olufunmilola Akinola is a consultant pediatrician at St. Ives Family Hospital. Thank you all for tuning in and listening to Radio Doctor. Thank you to the producer, Esther Laribe, and the executive producer, Tonwokewole Shunaya. Join us again tomorrow at 10 a.m. for Women's Health on Radio Doctor. My name is Rose Yusuf Kaiser. Good morning.
WFM 91.7.